A vaccine can be a powerful weapon in the fight against COVID-19, but only if it's taken.
Some people have concerns, even fears, about the vaccine. CBS 46 anchor Tracy Hutchins has a look at the hurdles that one community really has to overcome, Tracy.
Well, they really do. We really do, if you could say. Sean and Rick, with a COVID vaccine possibly ready for distribution next month, a new Gallup poll shows 58% of Americans would be willing to take it, but far fewer African Americans say they would be vaccinated. That's why black churches right now are stepping in to help close the gap.
The church has traditionally been the glue that holds black communities together.
He says, but Daddy, if I swim.
And now churches across Metro Atlanta are supporting and providing resources for parishioners skeptical of receiving a COVID-19 vaccine.
Will you get the vaccine once it's available?
Yes, I will.
Pastor Craig Oliver of Elizabeth Baptist Church in Atlanta will lead by example.
I would encourage it in the sense, that we're dealing with a reality that cannot be denied. The numbers are telling the truth. That is not something that has been created or even conjured up.
But it means overcoming decades of mistrust in the medical community. White doctors used slaves to hone their medical skills. Then in the 1930s, hundreds of black men were denied treatment for their illness in the Tuskegee syphilis study. And now in 2020, there are still concerns about systemic racism.
Just this week, I got a flurry of text messages of what to do to be a conscientious objector and what you need to tell the doctor that you don't want to take it.
Pastor Jamal Bryan of New Birth Missionary Baptist Church in Stonecrest says initially he was skeptical of a vaccine too, but now he's hopeful there will be no side effects.
I am championing social distancing and wearing masks and washing your hands. It took us 3 weeks to get an election verified. So I don't know what it's going to take and how it is that we're going to be able to give this out.
Yeah, a lot of people want to wait and see until they get the vaccine. Now, the National Medical Association, which represents African American physicians and patients, says vaccine developers, they need to support programs that help the black community in order to gain trust.